It's official, folks. RF Microneedling has had an official warning issued by the United States FDA. And I don't want to say I told you so, but I did tell you so. So I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And I've seen an explosion of aesthetic treatments over the past 2 decades, marketed as collagen stimulators, non-surgical tightening, and quick fixes for aging skin. And radiofrequency microneedling has been one of the most talked about and popular treatments for facial tightening, skin improvement, and non-surgical facelift type procedures. But that's likely all about to change. And in my professional opinion, it's about time. So let's take a closer look at exactly what radiofrequency microneedling does and doesn't do, and how to avoid some of the scary complications for yourself. Like every other treatment, there's some benefits to it, and there's also ways to minimize risk and improve outcomes, and we're gonna go over all that. But first, if you like learning about cutting-edge skincare treatments, make sure you subscribe to my channel. So let's get into it. So what is RF or radiofrequency microneedling? If you're not familiar with it, radiofrequency microneedling or RF microneedling uses tiny little needles as electrodes. Now, these electrodes transmit energy between them. Once they penetrate into your skin, they deliver heat directly into the dermis, and in some cases beyond the dermis. Now, remember, the dermis in facial skin is anywhere from 1 to 2 millimeters in depth. So a penetration depth that's greater than a couple millimeters is actually no longer in the dermis. It's in the subdermis or subdermal fat layer. These are important anatomic terms to understand as we discuss some of the complications that have come from radiofrequency microneedling and what has caused them. So the idea, in theory, is that you get controlled damage in the dermis, which triggers collagen production. That sounds good, and it's theoretically sound. Any heat in the dermis creates effectively an injury, and that injury signals cells, the fibroblasts, to stimulate more collagen, and therefore that's a good thing. Now, like everything else, too much of a good thing can be a bad thing, and it all depends also where that energy is being placed. If the energy is being placed in the dermis, well, you're going to get some of these collagen stimulating impacts. But if you go beyond the dermis, that's not what you're going to get. Here's the problem. Ultimately, there's a lot of nuance to this entire practice. Even simply getting heat into the skin can also be catastrophic in some cases, because too much of it isn't good for skin, and depending on the layer, etc. There's a lot of nuance here. There's a lot of technical nuance. There's a lot of, performance nuance. So this is not something that can be globally viewed as either totally, damaging or totally positive. But I'm going to give you guys some guidance after I explain this entire picture to you and really where the FDA was coming from. Let's talk about claims versus reality. So RF microneedling has had some very robust marketing, and it claims to do a lot. First off, marketing in this segment oftentimes likes to claim that there's skin tightening, or even sometimes more ambitious, there's actual facial tightening or laxity improvement. And this is, of course, how practices decide they're going to market their treatments and how they're going to communicate with their prospective customers. But there's been a wide range of claims being made by these devices, everywhere from just improving the skin, which is probably reasonable, to all the way from being a replacement or sort of a bridge to facelift surgery. But this is often misleading, because when you get these type of treatments, there is a temporary swelling that causes the face to look quite a bit tighter, sometimes for a few days, sometimes for a few weeks. But once the swelling goes down, then you're left with what you actually see. Now, what I hear from my patients all the time in these situations is, yeah, they saw some immediate improvement, the swelling then goes away, then they go back and they're like, hey, I don't see much of a change. And the response from the practices is often, well, you gotta wait, the changes happen over time. So it's almost like you have to delay gratification, wait 6 months, wait a year, and then by then you're probably due for another treatment. So it just becomes this perpetual cycle. And something that I just want you to put in the back of your mind, is just to make it really simple so you don't get duped into thinking, you're going to get a facelift result doing anything but a facelift. Real structural changes, change that comes from when you have gels and neck laxity and their facial shape has changed, can only be addressed with surgery. I'm sorry to break it to you. I'm sorry to put it in those kind of direct ways, but really at the end of the day, nothing that exists right now can replace surgery in terms of achieving actual structural change. So that should eliminate almost all of your expectations when doing these type of treatments. Now, its main claim is to stimulate collagen production, just like regular microneedling would, but more. And by the way, what is regular microneedling? Microneedling is just where you're punching a bunch of holes, like aerating your lawn, but doing it to your face with a bunch of little needles. And that also stimulates collagen because there's an injury from the needles. Same thing for chemical peels, same thing for lasers, same thing for a variety of different type of treatments. Any injury, perceived injury by the skin stimulates collagen. But the idea is by adding more energy, you're going to get a bit more of a robust, powerful collagen stimulation, which, to be honest with you, I'm not 100% sure the juice is worth the squeeze when it comes to this, but this is the claim and this is the expectation. Now, this idea is generally or theoretically legitimate if it's done correctly and if your skin can handle it. And what I mean by correctly, and I've spent so much time and energy over the last 4 or 5 years making, Instagram posts and videos on YouTube, etc., warning and helping people try to navigate through this. This is what I would say is the right way to do it. And by the way, we have a radiofrequency microneedling device in our practice, but we never use it aggressively and we never go deep with it. So the depth that we use in our practice is like 0.5, maybe a millimeter, but it's usually around 0.5. That's half a millimeter in depth, and maybe at the most, depending on the part of the face, to about a millimeter. And when you're looking at these different devices, it is very, very common for you to get a treatment that's 2 to 4 millimeters in depth of the face. Now, the problem is, again, that's where the fat of the subcutaneous tissues are, and putting energy into the fat layer can oftentimes cause the fat to melt. Now, this is the biggest thing that I hear from people literally all the time when they have had negative experiences with the devices, is that they have gone too deep and some of that very, very precious subcutaneous fat has dissipated and they feel like they look older, more lax, more just kind of weathered looking. And that's something that, clearly can happen. For a long time, I thought this was just, in people's heads until I just started hearing more and more and more about this. And so that's when I started taking it seriously and speaking about it. Here's the deal. So what the marketing doesn't always effectively convey is that this is a very powerful energy device that's putting energy in your skin, not necessarily on top of it the way it is with a laser or even a chemical peel. And since the skin is generally thin and everyone's skin is a little bit different in terms of thickness as well as the areas of your face, things can go awry very easily if your provider happens to go a little bit too deep and risks burning the skin, scarring the skin, the fat loss that we talked about, even hyperpigmentation issues from post-inflammatory, and worst of them all, if it's truly too deep, you can even get into some nerve damage. These are all the things that the FDA has basically warned against, who showed that these things can occur. And, I've literally have seen it so many times, unfortunately. So many patients have complained about this. This is, again, why I took it upon myself. And that's why I'm sort of relieved to see that the FDA has taken this matter seriously, because I felt like for years, patients who were treated with this and had the complications were raising their hands, screaming at the rooftops, trying to get the attention of others and let them know. The complaints that the patients are giving are not always those kind of like heavy-duty complications, but just that sometimes either it didn't work or they look older as a result of it. And that's terrible. And I got a lot of people coming to me asking me to do fat transfer to repair that problem. And the fact is, you can't really do fat transfer in the subcutaneous space. Fat transfer is done deeper. There's no good remedy for this particular problem, which is a really unfortunate thing. So I think like everything else, if it's done right and it's done superficially in the right settings and you're not trying to lift the face and be too aggressive with it, you can get away with RF microneedling if done properly in the right indications, but the indications aren't that great. There are not that many good reasons to need to do this. And if you are going to do it, make sure you're in the hands of an experienced provider. This is so, so important. All right, so depth warning. Let's get really granular and clear about this. I'm gonna tell you exactly what depths your provider should be aiming for at what places on your face. So around the eyes, no deeper than 0.5 millimeters maximum. In the cheeks and in the forehead, you can go a little bit deeper, probably between 0.5 and 1 millimeter to be on the safe side. I probably would say even 0.5 millimeters in this area will get you smack dab in the middle of the dermis, and you actually don't need to go any deeper than that. In the neck, the skin is even more thin, less than a millimeter for sure. The only areas that you can go a little bit deeper are literally in the perioral region, primarily in the upper lip and even a little bit around the chin. The skin is a little bit thicker there, so you might be able to go like a millimeter to 1.5 millimeters in those areas. These are just, very, very clear, not conservative, just really on point type recommendations. But what's happening in the real world is the providers are going between 2 to 4 millimeters commonly. And they have this interpretation that deeper equals better results, but it's not. It's going too deep, and that's where you start to see the fat loss and the aging and all that stuff, which is terrible to see. And I hate to break it to you, and I just alluded to it above there, but once you see that loss of fat in that subcutaneous area, it's permanent. So what are some red flags? I don't generally recommend RF microneedling unless you're completely confident in the skill of your provider and that they're talking to you about using some of these parameters and not wanting to go too deep. Because if you hear them wanting to go too deep, that's a huge red flag you should get out of there, in my opinion. Another huge red flag is if they're pushing microneedling on as a solution for everything. Remember, it is a skin treatment at best, and it should be used conservatively and done, very judiciously. And if it's claiming to do a lot of things like improve all your fine lines and wrinkles, discoloration, lift your jowls, lift your neck, etc., you're going to be disappointed, but also you're going to be potentially in the wrong hands. So that's a huge red flag. I'm a huge advocate and proponent of stimulating collagen. I mean, that is the name of the game in terms of anti-aging skin, right? I mean, skin is losing collagen that leads to fine lines and wrinkles and crepiness and all the things that make skin look old. But the truth is there are safer ways to stimulate collagen, ways that don't risk aging your face or damaging it permanently. And I think you should consider them before jumping into RF microneedling. I can tell you this for a fact, it's one of the least used treatments in our office, and we have a lot of different devices from lasers to microneedling to RF microneedling, etc. And this is one of the least used devices. But there are indications that they do come in handy, but they have to be on a very case-to-case basis. So what does actually work? In light of the FDA's official warning on RF microneedling, here are a few anti-aging approaches I prefer to still stimulate collagen, help you age in reverse without the risk of permanent damage. So at the top of that list in terms of devices is cold microneedling. And what I mean by cold is, again, no energy involved in it. It's just the standard microneedling you get in an esthetician's office, a med spa, etc. We have it in our office. We do this a lot, by the way. In fact, my wife does it on her neck every 6 to 8 weeks, and she's been doing it for years. And it just helps stimulate collagen, give you that boost on top of the other things that you're doing. But it is a very, very safe procedure. Lower risk, still effective collagen stimulation. I love this treatment. It's one of my favorite in-office treatments to boost skincare. Now, how can you improve it a little bit? You get a little bit more of a boost, you can add PRP. So this means platelet-rich plasma from your own blood is taken, and then once you do the microneedling, you add the PRP to it, so it creates almost like a collagen boosting effect, a little bit of a more robust and an impactful state of collagen stimulation. It's a legit medical procedure that has literally been around for a very long time, and it has a lot of uses for healing, etc., outside of just facial skin. So it is definitely a useful procedure to do. It's a bit more expensive, a little bit more time intensive, no increase in risk, but overall these two procedures have a huge benefit to risk ratio. I mean, it's a no-brainer for me. So what about chemical peels and lasers? These are also very, very effective, tried and true procedures. They've been around a long time. They work on the surface of the skin. So if you're in the right hands and you're not overdoing these procedures, they're generally very safe and will give you the expected results. But the reality is chemical peels and lasers can definitely cause a lot of complications, burns, scars, etc., if they're done too too aggressively, overzealously. So I think what you're hearing from me is that if you're going to give your face or your skin or whatever it is to somebody to do something with, you better make sure they know what they're doing and they're experienced, they have integrity, they have the right training, they have a good track record, and ultimately you trust them. That's really, really important. When you put it all in perspective, overall, I think there's just better treatment options out there than RF microneedling when your goal and hope is to stimulate collagen, right? So I would recommend you try them out before resorting to radiofrequency microneedling. But here's what I literally tell patients all the time. If you're trying to keep your skin looking youthful and healthy and vibrant, good for you. This is very, very important. This is equally as important as surgery. So I put that right there along what I do in the operating room. But the thing is, the things that are the most impactful are oftentimes the easiest, and they actually cost the least. So for example, number one, simple sun protection is very, very important in terms of aging the skin. So always make sure, and I beat that horse to death really, but at the end of the day, I want you to recognize how important it is. 80-90% of skin aging happens because of sun exposure. So make sure you're good with that. Number two, right up there, is skincare. Now, I'm talking about the things that stimulate collagen, they decrease pigmentation, things like retinol, vitamin C, niacinamide, all these important actives that are actually doing things at the cellular level to your skin. You combine those two things, and I'm telling you, you will see major changes in your skin in the long run. And remember, this is not a short-term type of thing. You're running a marathon. You're trying to beat aging in the long run, right? Skin aging. So keep these things going in the long run, and you'll see massive changes accumulate, just like compounding interest, right? These are very, very important. Putting this all into perspective, this is the hierarchy. Number one, you start with sun protection. Number two, you get on a really good anti-aging skincare routine. Obviously, the one that I strongly advocate for and really believe in because I see the results every day. It's what I use, what my wife uses, my patients use, is the Karam MD trifecta. It kind of is a no-brainer for skincare, anti-aging wise. You do these two things, you are really going to win the game in the long run. Then on top of that, you want to get a little bit of extra boost. You do what my wife does, goes in and gets a little bit of microneedling done, right? That gives a little collagen boost, not necessarily using radiofrequency. And here's the interesting point here. So I think my wife has some pretty amazing skin. She's been at it for, since her 20s. So it's like 25 years of it. She's never done deep lasers. She's never had to do RF microneedling on her face, etc. She's really, really been mostly sun protection, skincare, and a little bit of light treatments here and there with the occasional chemical peel back earlier on, and then, of course, the routine microneedling. That's it. And if you do those things, it's super efficient, risk is low, your skin gets better year after year, and you're in it. You're in it for the long run, and you're gonna win the game. Quick note on the neck, one more thing. Whatever you do to your face, do to your neck. These areas age together. There's really nothing worse than seeing people with young-looking facial skin and aged-looking neck skin. Karam MD Trifecta was literally designed to be a neck cream in addition to a face cream. A lot of times retinols and vitamin C's can be a little too harsh on that delicate neck skin, but make sure if whatever you're doing, you're using it on your neck as well as your face. Sunscreen, same thing. Treatment, same thing. So don't make yourself play catch up later. Stay in front of it. The sooner you get started, the better. It's never too late, but honestly, the sooner you get to this, the better. And one thing I just want to give total perspective to is that anti-aging really requires two-pronged approach, really what it is. You take care of your skin the way I just described it, and then you take care of the structure one time when the laxity starts really becoming significant enough for you to want to do something about it, and then you do surgery. So skincare forever, 1 or 2 times in your lifetime you have a lift, and you could be 80 and your face and your skin will look beautiful and youthful. That's truly defying aging in a very logical way. So keep that in mind. A lot of the stuff in between can be omitted from the playbook, and at the end, you're gonna see yourself, succeeding with this. So the bottom line is radiofrequency microneedling can work, but the risk to reward ratio is not great, especially when we have so many other safe alternatives. So if you do it, stay under 1 millimeter for most areas, find a provider who listens and who's experienced, and ask them questions about depth, or simply consider just doing cold or regular microneedling with PRP instead. Whatever you do, however, don't skip on your daily active skincare and SPF. It's the foundation which we'll build on other treatments on top of, but no other treatment can replace those two things. If you found this video helpful, hit subscribe, like the video, and share it with somebody who needs to hear this. To dive deeper, check out the Karam MD Journal, which is a newsletter that is free and comes to your email box each week. Great insights and a great way to stay on top of everything. If you or somebody you know has been affected with RF Microneedling, I would love to hear from you in the comments. Share them so others can learn as well. Thank you so much for watching. Until next time, Dr. Amir Karam.